Hi, my name is Terry Dorland with Rise Local TV, and I am very excited today to be here with Dr. Kimberly O'Sullivan of O'Sullivan Plastic Surgery in Wellesley, Massachusetts. And today we're going to be discussing finding a great plastic surgeon. Dr. O'Sullivan, how are you?
Good, thank you. Thank you very much for having me today.
Oh, you're welcome. Thank you for being here. So, Dr. O'Sullivan, help us out here. And when someone is out there in the market looking for a plastic surgeon, I mean, it's a big expense and it's a big undertaking that people are going to go through here. When they do a search, you know, there's 10 results on the first page of Google alone. There's so many different websites touting how great each surgeon is. In your expert opinion and with all your experience, what should people really be looking for? What types of questions should they be asking?
Well, I think the ratings are out there, and it's hard to get away from those. And some of them are going to be excellent, and some of them are going to be bad, and it really depends on the doctor-patient experience. But I really think for any patient going through a surgery, which is a big thing, it's not just an injection, but it's a real deal, it's important to consider those Google ratings, but meeting the doctor is really the most important thing to do. The reason is when you meet that doctor, you can determine if you like who they are as a person, and you can see firsthand pictures of before and afters. Now that, in my opinion, is the most important thing. The reason is every physician has a different set of aesthetics, and what's important for the patient is to be sure that they are going to find the doctor whose aesthetics will meet their expectation. And really the only way to figure that out is to look at a large number of before and afters for the procedures that the patient is seeking. Also, I think it's very important for the patient to know the doctor, see how they behave, and determine if they like that doctor as an individual. And so for me, meeting the doctor is probably the most important thing in order to proceed forward. Then the next thing is the doctors have to really educate the patient. And so you have to really know if you feel as though you understand what you're proceeding forward with when you go to that physician.
Well, that makes a lot of sense, Dr. Sullivan. You know, you made a great point, in my opinion, that you know you really have to have the same level of aesthetic expectations, because if you don't like the results they've given to other people, how are you going to be happy with what they've given to you? And that makes a lot of sense. Talk a little bit about the patient experience that someone would get if they were to come in and see you. I know you're doing some really special things over at your practice.
Well, at O'Sullivan Plastic Surgery, we have two plastic surgeons, Dr. Renee O'Sullivan, who's been in practice for over 30 years, and Dr. Kimberly O'Sullivan is working more as a patient advocate consultant. And when you come to O'Sullivan Plastic Surgery, you will get a very detailed, patient-oriented experience with a very extensive discussion. The consults are typically 1 to 2 hours, and those will go over all the options that the patient has to consider, which is very important. With most surgeries, there are different types of procedures that can be done, and the result for each procedure will determine whether or not the patient wants to proceed in one direction or the other. So having an educated understanding of the options and being able to see pictures that reveal what to expect from each option is very helpful for the patient. We never cut short that consultation. We'll also explain all the risks, all the complications, so the patient understands what they're getting into. But to spend time to detail everything, I believe, is very helpful for the patient to really be educated and make a decision that they're comfortable with. During the surgery, again, we're very detailed. We don't do multiple surgeries a day. We do 1 or maybe 2 a day so that we can spend as much time as necessary to make a beautiful and perfect result.
Well, that sounds like a very, very patient-focused and patient-oriented practice. I know you have a special offer as well for people who happen to be watching this video. What can you offer them to come in and experience that difference?
Well, over the next month through the end of June, anybody who mentions this show will get a free consultation. And we look forward to meeting you, and either for your surgical needs or for any patient advocacy needs. With this changing arena where the hospitals are becoming run by large CEOs and the medical systems are really putting the patient and the doctor at bay while they make money, it's very hard to know if your care is really for you to improve or for those that you love to improve. So if you have any patient advocacy concern or question, give us a call and speak with Dr. Kimberly O'Sullivan. If you are interested in a surgery with a gorgeous result, then you can speak with Dr. Renee O'Sullivan.
Okay, Dr. O'Sullivan, what is the best way for someone to go ahead and get a hold of your office to talk to either you or your partner?
781-235-1007 is a telephone number. O'SullivanPlasticSurgery.com has a large number of before and afters for the patients to see, and we look forward to meeting you.
All right, Dr. O'Sullivan, thank you so much for being here. You've provided some great insights.
Thank you. Have a great
All right, everyone. Thanks again for watching, and we look forward to seeing you again on another one of our expert interviews.